Hi, I'm Fatima Villarreal, and I'm gonna talk about patient safety and safe surgery. The patient safety in surgery begins before entering the operating room, and it involves preventing all types of medical error, especially surgical ones like wrong site, wrong patient, wrong procedure, or retained objects. The key is structured communication between the patient, surgeons, and the entire healthcare team, since everyone involved must work together to prevent surgical errors. There are preventable surgical errors, which are the wrong side surgery is the most reported sentinel event, occurs across all surgical specialties. And there's an example in obstetricians gynecologist, which is the tubal ligation without consent. There's the terminology. There's the wrong patient, which is the surgery performed on the wrong person, the wrong side, the surgery on wrong limb side. There's an example which is the left ovary instead of the right ovary. On the wrong label part, correct area, but incorrect anatomical level or section. There is the systems approach, which are the prevention requires teamwork and leadership from the primary surgeon. There are risk factors such as multiple surgeons, multiple procedures, time pressure, unusual anatomy, or pure communication. And there are the pre-op review of history and imaging is essential. There's the universal protocol, which is the procedure verification. Um, Check the documents, labels, equipment match, patient identifiers. There's the marking the site, which it has to be clear, consistent marking, never mark on the wrong side, obviously. And there's a timeout, which is the final theme confirmation before starting the procedure. And there's the WHO, which is a campaign, a surgical safety checklist. There's a review it at three moments: before the anesthesia, before the incision, and before the patient leaves the OR. There's a team based verification that reduces risk, and any team member may stop the procedure if something seems wrong. There is the WHO, which is a campaign. I told you already. It's the Safe Surgery Saves Lives campaign, and this aims to reduce adverse events through safe surgical practices. There is focus moved from only technical skills to also communication and non technical skills, and surgeons must learn from mistakes and share experiences with trainers for lifelong learning. The safety best practices in surgery. The patient safety is now a core part of healthcare quality. Evidence based practice reduce harm, improve outcomes, and lower cost. The teamwork is very essential. Professionals must apply, measure, and follow best practices. And the surgery must rely on evidence, not only the individual skill or self evaluation. There are many factors influencing patient safety, which are the healthcare is less safe than other high reliability fields, such as aviation, nuclear. There is the surgical safety depends on many steps along the patient's pathway. There are surgeons who require strong cognitive and manual skills, and techniques, trainment, equipment, risk, and infection control all impact on patient safety. There are techniques and procedures that are major shift, more outpatient surgeries due to improved techniques. The patient must be more informed and involved, especially with home recovery. There are new technologies such as prosthetics, sutures, antibiotics, DVT prevention, change protocols, and constant updates to guidelines and better training of residents are necessary. There is the surgical equipment and instruments. The industry improves ergonomics and usability of instruments. The surgeons test new tools before release to ensure safety. They are better designed to shorten the learning curve and reduce errors. And there is improved prosthetics materials and minimally invasive surgery allow faster recovery. Pathways and practice. The ERAS protocols improve outcomes and standardize care, reduce variations, reduce cost and disparities between patients. Outpatient pathways are used for many minor procedures, and changes in equipment, training, and policies directly affect the